Now, I want you to raise your hands if you were yesterday present at the innovation speed talks, the ones where people were here pitching their health innovations. Okay, just very few of you. Okay, so you may remember that I mentioned a link where you could vote. For those of you who didn't receive it yesterday, there was another link that was sent this morning, specifically at 10:30 a.m. with the title, Vote for the Health Innovation. So if you received it, please take a look, vote. If you weren't here for the speed talks, you can just go upstairs to the first floor to the booths and talk to the representatives of these innovations. Very interesting. Make your decision, vote, and we will be announcing the winner on the very last day at the closing ceremony. Now for the next panel. In the previous panel, we did heard about the operational aspects that private sector can take towards the One Health approach, right? Now, we will be looking at how we can actively implement this approach as well as what is currently being done. For this session, we will have a total of 8 speakers, 2 joining from sending 2 videos that we will be watching. So we have first, I have the order in here, actually, the order modified. We first have Natalia Cediel from the University of La Salle in Colombia, and she is member of the One Health High-Level Expert Panel. We also have Armel Herbe, one environmental health and a member of the French Water Partnership. We have Namukolo Kovic, International Livestock Research Institute, and that is actually a recording that we will have. We also have Amandine Gauthier from the Vet Agro Sup. And we also have Hélène Delisle of Université de Montréal. Joining us virtually, we have Rhoda Wins from the Macquarie University School of Public Health. We have Juan Lebroth from Lebroth One Health Consultancies. Welcome. And we also have Chris Walzer from the Wildlife Conservation Society. Many panelists indeed. And last but definitely not least, let's welcome our moderator, Benoit Miribel, Secretary General, One Sustainable Health for All Foundation. Welcome.
Hello, welcome. Thank you for introducing all the panels, all the speakers, and welcome to all of you for this session. Just a few words about the One Sustainable Health Forum. It was launched last July from Lyon, close from Geneva, by the foundation One Sustainable Health for All. And most of the experts today are working for a long-term period, trying to make operational with good practices some guidelines. It's what we are talking about together. And so we are going to see, because we have launched 6 international working groups, we are going to illustrate, to see more in the details, where do we stand by making operational. You remember that yesterday on the stage, during the opening, Dr. Monique Eloi from OIE was talking a lot about One Health, and mentioning that since now we know that we have to go, the question is not, do we have to integrate One Health? Of course. The question is how to make it, how to do it, because we know that we have some silos, and we need to have an integrated approach. So we have a good range of experts here. I know that it may seem like a TV game, but they are not going to push like this. It's not a game, you will see. I'm going to start with one question. But before that, we have the pleasure to have Natalia Cediel, and you are a member, as it was said, from the International OLEP expert committee. from UN agencies, the 4 UN agencies, and we would like to know, to hear you about how do you see, you know, the reality of the One Health approach, and you know that we are especially focusing on one sustainable because we want to contribute to the SDGs also. So we would like to hear you a few minutes before going the details of the International Working Group about what you see and what you recommend.
Well, good afternoon, everyone. Thank you very much for the invitation to share with you the experience that we have been gaining and knowing from the last year with the panel. Yesterday, we had the presentation of the panel, and we know already that this panel is to provide evidence-based scientific and policy advice to address the challenges raised in the animal-human environment interface using this One Health approach. Since the beginning of the conversations among the member panels, we were noticing the connections and the opportunities to cooperate with the SDG work that was already in place of the world in the Agenda 2030. So when we were working on the visual of the definition, of the new definition that we wanted to address more clearly the environmental challenges and the environmental participation on the definition and the implementation, we wanted to address the 4 C's, as you probably saw yesterday in the graphic or in the visual. The 4 C speaks on communication, collaboration, coordination, and capacity building. So it implies directly from the beginning the political will, the resource allocating, the commitment of the political, the higher political level, but also it implies the community engagement, the importance of the importance of top-down initiatives and bottom-up initiatives that are clearly a way to work to achieve the sustainable development goals that we already see in the world. Another key contribution of the HOLEP panel was the development of the One Health Joint Action Plan that yesterday we saw in the opening ceremony. Has 6 action tracks, mainly on enhancing the One Health capacities to strengthen health systems. Second, reducing the risk from emerging and re-emerging zoonotic epidemics and pandemics. And the third one, controlling and eliminating endemic, zoonotic, neglected tropical and vector-borne diseases. So we are worried also for what is happening on many countries, for example, mine, which the burden of disease is still high on the preventable vector-borne diseases and the neglected diseases, not only the emergence of new ones. The fourth action track is the strengthening the assessment of management of food safe risk and the silent pandemic of the antimicrobial resistance. And the sixth action track is on the involvement of the environmental and One Health aspects. So to achieve this, during the panel meeting sessions, we were acknowledging the difference among countries, the high-income countries and middle-income countries, low-income countries, and the realities on the health systems, especially surveillance, capacities, the data sharing, all the key aspects that are important on the making real the concept of One Health. So that's why we wanted to address the underlying principles to connect the implementation to context-specific situation analysis. So we wanted to address 5 principles to give clarity on the importance of equity, the equity not only among sectors and disciplines, but also equity among the different socio-political groups, especially the voice of marginalized voices, the voice of the people who are normally not heard, not involved in the design of health policies. Also, the socio-ecological equilibrium, because we know that the interaction that we need now must be balanced between the human, animal, and environmental representation, and the stewardship and responsibility of humans to adopt this change, the change behavior that we need, that we were talking yesterday also in many panels, how to achieve this behavior change. And finally, but not the last, the transdisciplinarity and multisectoral collaboration, because this includes not only the relevant actors, but within, let's say, the traditional forms of knowledge based in community, but also the not only community, but also the NGOs, the importance of academia, the importance of key stakeholders that are involved in specific problems. I'm not sure how much time.
No, please go.
Okay. So the last thing to mention is that we are developing, is in process to release the theory of change, because we are working very hard on understanding what are the outcomes that we want to see at the global level, national level, local level, understanding what would be the outcomes, the impact, but mainly we are focusing on the barriers that we have for implementation. And as the theory of change is focusing on how to address those barriers, I wanted to share in this panel what we achieve at the moment is we are classifying the barriers in three types of conditions, or there are three types of barriers. First, the barriers regarding the insufficient conditions to start, that are related mainly with the policy and funding, and related also to the education and training. These both aspects or categories are related to how to start an initiative. So we need the policy, funding, education and training. The second barrier, the second category, is the execution, how to really make real the cooperation. So it has to be with the lack of surveillance systems, the lack of, for example, the lack of data sharing, the fragmented surveillance systems, the silo budgets, the silo thinking, the unequal power and representation of disciplines, and we are addressing a little more with the new definition, the aspect that was lacking in many of the places that we have experiences, that the sector of environment were always left behind of the conversation, and now we are seeing that with the new definition and with this new theory of change, the importance of involving the environmental aspects. And the last type of barrier, the last category of barrier, are the barriers related to the monitoring and evaluation, because we are not giving evidence on the benefit of the add value of the One Health initiatives. So for policymakers, it's very important to have those evidence, and academia or other sectors we are failing in some way to give that evidence, to understand what is the benefit of collaboration, how much money we save if we collaborate together doing initiatives, multi-sectoral activities, and the lack of guidelines, metrics, and indicators to evaluate the One Health initiatives. So with that overview of the barriers, I hope with the panel we are working on releasing the theory of change in 3 different pathways. So the first pathway is that we are working is the policy, advocacy, and financing. This is going to be a huge aspect of the theory of change. So we would like to give guidance on policy development, political will, enabling regulatory frameworks, and intersectoral governance, as was explained as the Dr. Hans Klung. The second pathway of change is the organizational development, implementation, and sectoral integration. So in this pathway, we have all that is regarding the One Health intervention, including scaling up the capacity development at regional and country level, the community engagement and mobilization for action, the communication and equal integration of each sector, especially all the soft skills that are needed to cooperate, to build trust, to build teams, to create good governance. And the pathway 3 is related to data, evidence, and knowledge. That we are thinking is focused on strengthening the scientific evidence base, the knowledge translation into data for evidence, technical tools, protocols, information, and surveillance systems. So we have a lot of things to do, but with this theory of change, we hope to give some clarity on where to start for a country, for a local community, what we need. And I hope that for the next months, we are going to be releasing this theory of change, but soon is going to be published the definition and the guidelines that I just mentioned on plus pathogens, that it was accepted like 1 week ago. So that's what I have from the panel, and I would like to share more about my experience in my country with communities, with grassroots communities involving the gender equity, because we have seen that good practice to make this happen in the real, in reality is the gender equity, especially in rural settings, remote, abandoned rural settings. So thank you very much.
Thank you, Natalia. It's a large view of what is at stake by implementing the One Health. And you mentioned several points and the action plan. You mentioned also the theory of change, of course, and the barriers that we need to tackle, to be tackled. And you end up, so you said many things, and thank you for that. And you end up also mentioning the local community and how to have, you said also from local, regional, international, how to share the information, the good practices. It's a big challenge for us, but I think that we are all convinced, even as you said, that for most of professionals, it's not an evidence. So we have to prove that the One Health is a reality. I know some people that say One Health, or it's blah blah. No, it's not blah blah. And we have to make it concrete, as we know. And so now we are going to go more deeply by having a look to the international working groups. So the One Sustainable Health Forum started in July to be open to experts coming from everywhere, having the wish to work. And so we have the first international working group, the number 1. And Armel, you are going to tell us about what is about, by the way, and why it's relevant today for having this first working group.
Okay. Is it great? Thank you, Benoit. Thank you to all of you and for this invitation. So I'm also glad to share with you the title, the topic, the objective of the I Working Group 1. So from environmental health background, we are in charge to work on the mitigation of environmental pollution impacts, considering the planetary boundaries towards one sustainable health. So we are about 10 or 12 in the working group. with a different mix of knowledge and background from, how to say, medical physicians.
You have to speak closely to the...
Yeah, sorry. Is it better like that?
Yes, that's better.
Sorry. So we are a team of about 12 persons, and we are working on how to consider the historic and the current pollution of all our environmental components. So we are considering the air, water and soil linked to anthropic activities that are deeply harming citizen and ecosystem health and development. So we could also consider that the most efficient and sustainable business model on Earth is the living. So with regard to this comprehension, we can also consider that only a safer environment can protect early stage of livings and development and provide sustainable added value for all. So One Health, as explained by Benoit, is both a global approach but an outcome that is needed at whole level. So the mission and the objective of our working group is first to gather all existing information, because as you may all know, there is a very large number of One Health initiative, about more than 100 worldwide already. So the main challenge is already to consider the state of the initiative, the policies, the guidance in policy, research, technical gaps on evidence. We also estimated that it was very interesting to consider the international harmonized framework, DPSIR, to consider the driver that are related to anthropic activities, the pressure of these activities, the state of the different components, the impact for human ecosystem on animal and environmental health, and the R in terms of response, what could be or what are already, but what could be the political, legislative, non-legislative or economic potential response. We also have in mind to take into account which kind of, what paradigm shift and innovative metrics are needed to be refined. As you told just before, in terms of all the knowledge, the data, we have also to consider the cutting-edge science to be especially more integrative and holistic in terms of health, especially for the most vulnerable exposure period of life, because now I think we know that for ecosystem for a long time, but also for human now, we know that the genome are very and extremely vulnerable to chemical pollution, even at low dose mixture. So we have also, and especially with regard to chemical pollution, to protect the 1,000 first days of life for human, but respective for all the livings.
Okay, Amel, we will go back. I will go back to you.
Yeah.
Just to mention for the at the first step the title of the international working group. So you are in the first international working group, and it's about mitigating the impact of environmental pollution, climate change, and pressure on biodiversity to promote better health outcomes. That's right.
Yes, we
and
just
you are, for the moment, 10%, and it's open to experts.
Of course.
And I will come back to you because it's good to announce what kind of expert would you like to see in the working group, you know, because we believe in the diversity and different also scale of responsibilities. So we will come back to that point, but before listening to Namukolo Kovic by video, we go to the number 3, international working group number 3, with you, Amandine. Can you tell us about the topic of this international working group and how did you start it?
Yes, thank you, Benoit. Can you hear me?
Il faut bien parler devant. You have to speak very closely because.
Okay, here. Okay. Thank you, Benoit, for inviting me. So the group is about is called now How Human Interaction Relationship with Nature Must Evolve to Achieve One Sustainable Health. So if I may develop a little bit, I'll try to be short, but our objective is this working group is to go, let's say, beyond the perhaps unrealistic rhetoric of unity and holism and ask what does One Health in the real world mean? And what needs, of course, to be done to better link research with policy and action for impact across sectors. You know, Benoit, that an increasing number of anthropological and sociological studies have revealed how complex social, cultural, political, professional, environmental, economic, we can develop determinants influence health interventions. I think about zoonosis, of course, with the example of bushmeat hunting, but I think about the AMR, the fight against AMR, and the importance to understand both the uses of antimicrobials and the constraints for the stakeholders, what matters for people at the end, and at the same time not neglect the drug market, the illegal markets, etc. So in a nutshell, I would say that everything is not a question of resilience. So that's the main topic here in this working group, because those studies all highlight the importance of culture, of values, the perception of the risks, etc. But unfortunately, if I may, the characteristics and the practices of populations are most of the time considered as only breaks to action or risk factors. So here, these groups propose to take a step aside by putting the relationship populations have with the rest of the living world as being at the core of sustainable health for all. So it's a very different perspective, I think. So we reflect basically on the current and future modalities of these relationships. So this approach, I think it's a very important aspect too, because this approach makes it possible to overcome the usual separations in terms of risk management, in terms of governance, between the North and the South. Indeed, we find it preferable, rather than making a distinction between North and South, to describe different milieus, that is to say, land uses and farming, coastal and oceanic areas, including fisheries, forests, etc., to see, finally, how human interactions with the so-called nature can evolve and can be improved to achieve one sustainable health.
Thank you. We have also Hélène Delille from Université de Montréal, and you are involved in the International Working Group 4. We met years ago, and we were working on the access for food. We were working together with Action Against Hunger. I'm very pleased to have you in this OSH forum.
I'm pleased too.
You too. Good. Can you tell us more about, the groups? How did you start? And the topic of the International Working Group, which is related to the access.
Thank you. It's a pleasure to share with you some of our, what should I say, the ongoing work of our working group on equitable access to health. Now, the justification for this topic is that, after all, inequities in access to health are a major obstacle, not only to achieving the One Health agenda, but also the SDGs. And we think that the health equity focus of our group provides a lens to optimize the recommendations of the other working groups, whether it be climate change and pollution, food systems, the human interaction with nature, governance, local communities. So it's a health equity lens that we provide. We began by changing the name of the group from access to health care. We substituted equitable access to health-related services so that we go beyond standard medical or health care to broaden the scope to also consider health information, resources, innovation, and community health services. To also encompass health promotion, the whole spectrum of health promotion, prevention, treatment, rehabilitation, and palliative care. An important point is that we intend to include equitable access to the main determinants of health. As WHO stated, the determinants of health have even a more important impact on health than health care and even lifestyle changes. So this is important. And we also intend to look at access to agriculture and husbandry information and extension. So our objectives that we wish to fulfill are to develop and accept and disseminate a conceptual framework for a systematic approach to equitable access. We have work in progress for that too, looking at various issues of equity, the whole spectrum of health-related services, and then segmenting the stakeholders as regards training and information, research and monitoring, and interventions, among others. A second objective is, of course, to identify key promising research areas and operational strategies in the light of a scoping review on health equity. The scoping review will also inform the conceptual framework. We also intend to design a narrative for advocacy and finally to define a plan for the implementation of the recommendations and its monitoring. So far, we have quite a diversity of experts. Perhaps we will need more in the area of advocacy, marketing, and, I insist on this, implementation science, because implementation science can do a lot to improve health equity. I think I'll stop there.
Thank you, Hélène, for giving us the details and about the topic of this International Working Group 4. We will listen later Rhoda Wayenze about the International Working Group 5, and we go directly to the 6th for the moment with you, Juan Rebroth. So what is about the International Working Group 6, and how did you start it?
Our working group, and you can hear that everybody is still work in progress, so we are developing different ideas and the methodology that we are proposing. But our working group, International Working Group, is on to developing sustainable health practices and resilience within the local communities. So we even heard this morning in this same room Javier Castellanos from the International Federation of Red Cross and Red Crescent talk about the importance of the community. And that, to translate the conceptual framework to attain One Health in a sustainable manner, One Sustainable Health, requires converting theory into daily practice. So success would be measured at the local level of what we are accomplishing as a group, be it rural, urban, or peri-urban, to ensure protection of health for multiple generations. So that's what our work is. And our work will be heavily focused on education, training, communication, capacity development, and not only formal, but also the informal, capturing that mother-daughter, father-son, those relationships that are so important in the community, the understanding the teachings of the elders to the next generation, building skills in the community on One Health matters for sustainability. Being able to translate those central policies into a decentralized environment and applying those, adapting those to the prevalent situation that community finds itself. So it's also on finance, how to manage that finance, what are the best health practices? Be sure that we have included that equity, that being gender sensitive, understanding those relationships. One of the areas that we've been discussing and requires further discussion, is there a baseline, a minimum, a scorecard? Like, we know that if we want to stop a certain infectious disease, we need to vaccinate X amount of the population. Would there be, for us to determine, is there a One Health thermometer for the community that we can reach? And I'll talk about that more later in the next round. Thank you.
Thank you, Juan. So now we are going to listen Namuko Lokovic from the group International Working Group 2. And it's about, she's from the International Livestock Research Institute. And the International Working Group 2 is about sustainable food systems for improved nutrition and health. So it's just 3 minutes video.
Thank you for giving me the opportunity to contribute to the discussions remotely. My name is Namkolo Kovic. I'm Director General's representative for the International Livestock Research Institute to Ethiopia. I am also the current president of the African Nutrition Society. I co-lead Working Group 2 with Professor Fanzo at Johns Hopkins University, and our focus is on one sustainable health towards sustainable food systems for improved nutrition and health. We are putting a One Health lens on food systems transformation, and our work thus far is looking at 4 categories of challenges that we need to address. The first is to do with practices that are in place and looking at synergies and trade-offs. And then also other challenges that emerge as we have seen, such as those presented by the COVID pandemic and the issues that has exposed from a One Health perspective. The second category is on challenges on One Health governance, particularly looking at lack of governance instruments, also lack of capacity to actually implement a One Health perspective within food systems transformation initiatives. The third looks at challenges that need to be addressed in response to food systems perspectives in different settings, associated with things like production, mitigating against misuse of fertilizers, chemicals, antimicrobials, and the like, and also handling of foods from a food safety perspective, and others that might emerge. The third category looks at things that are emerging in the global south that requires different attention, specifically to do with as we transition to more monoculture, the related deforestation, misuse of chemicals, and the like. The global south requires attention as well that is more contextualized.
So now I would like to come back to you, Hélène, after hearing Namukolo, for a second question, and I will also ask to the other, of course. Do you think that this One Health approach, somehow, it's a way to work together, to bring synergies? Because, we discover sometimes the capacities of others that we don't know. When you are working, for example, in urbanism, you are not always talking to those who are the specialists of infectious diseases. So beyond, the human, animal, environmental, because we have all together the DNA, the life, but beyond that, I think that we are discussing in the International Working Group, and as you mentioned, Amandine also, we are discovering that we have a big capacity of sharing knowledge. She mentioned synergies, lessons. So what do you think about that, and how do you see it in the working group?
I think this initiative is going to give momentum to this One Health approach. And what we are discovering is that, yes, we can work together, but at this time, it's primarily rhetoric. We're talking a lot, we're discussing, we're enjoying ourselves in discussing, but what about what's going to be happening in the field? You know, implementation. Implementation is so important. And to me, one key would be decentralization of it all and local ownership. We can see here, it's quite Euro, or at least North-centric. We have group leaders who are from other countries, but I think in decentralizing, we've got to associate local experts, but also local community representatives. And from my own experience, I think it's easier to have trans-sectoral or cross-sectoral activities or action at the local level, at grassroots level. And perhaps the pressure from the local communities will help those who are aware or who talk about it to implement those policies, those programs that will facilitate the One Health approach.
Thank you. Amandine, so you are, of course, being at Vetagro, involved for years in the One Health and the cultural aspect also. How do you work with this working group, number 3 of Research Forum, with the others initiatives, yes, where you are members? How do you see the link and what is moving forward and what do you recommend to pay attention now?
Well, there are several things. Considering the theme of the working group, of course, the representatives of humanities and social science have to be quite important. We are 3, I think, for now, almost 4, but also with epidemiologists, medical physicians, ecologists, who are very engaged, involved in many fields of the world. But I would add that, of course, we have to do also with existing expertise and existing working groups, because there are some expertise available on about the themes we are interested in. And perhaps just a third element to answer your question is about despite the emphasis on collaboration and interdisciplinarity in research, we can see that scholars, even if we are making some progress, scholars from the global south remain marginalized, I think, in my group. And it's also what we observe regarding their limited capacity to shape the agenda. So it's not. I think it should allow us, sorry, to emphasize the socio-political dynamics as well.
Yeah, I know that's very important, this social political dynamics. And Juan, so coming back to you with the International Working Group 6. We know that in each working group it was defined by the scientific committee, and we will of course listen to you, Chris, later on, but you are one of the most involved experts in One Health for years, so I will come back to you as agreed at the end for a global view. We are still now talking about the International Working Group, but Juan, the Working Group 6, do you have the diversity that we expect between research, practitioners who are implementing, and those who are making the rules, who decide for biology or what else? What are the rules? Because we know that we need to have a real diversity in the working group. Natalia bring many challenges by opening this session, and we try to tackle it, to contribute, to make a contribution to this movement through this approach. So how do you see the evolution of the Working Group 6?
Again, Working Group 6 is looking at the community, and the short answer is no, we don't have the right mix of people. although we are quite, there's 24 of us, we have a kind of a wide representation from both hemispheres, not as wealthy as it should be. Yes, we have the veterinarians, and we may have the physician, and we may have the ecologist, but not all veterinarians are created the same, and not all physicians have that public health expertise that maybe is required, or not all physicians know about pediatrics or prenatal care. So we do see the importance of sociology, anthropology to be included, also finance. We do see that with the wildlife-livestock interaction and that conflict resolution, we may need to be able to look into that, and we need that expertise. And hopefully Chris will at least bring that issue up between food production and conservation. We need educators and communication specialists, certainly, in our group, if we are to have that strong push on capacity building, training, education. Yeah, I would say that those that are also much more competent than myself on gender issues and community and response and inclusion. And if we do believe at the community level that we need that bottom-top approach, and if there's indigenous knowledge, they have to be part of that discussion. Absolutely. And I don't have that.
So this is why it goes, we cannot arrive and say, we have the solution, these are the protocols, the guidelines, just implement it, we have the money. It doesn't work. Yeah. And I just mentioned that all the experts involved in the OSH forum, One Sustainable Health Forum, are volunteers. Nobody is paid. It's just because they have the conviction that we need to work together. This is important to mention. It's true that we cannot grow flowers by pushing on it. Huh? It takes time, and it's the same with the community. And it's so this is why there is a kind of theory of change and theory of approach. I was on Wednesday in a debate about with a humanitarian specialist, and they said we need to integrate to include ecosystem approach in humanitarian action, because for years it's, you target life saving, but if you don't take it as a whole with the ecosystem also, you could have side effects. So and yes, the key point is with the communities. But coming back to the working group 1, how do you see you were coming back from Africa? You were in Dakar for the World Water Forum, because the working group 1 is about air, environmental, climate change. And of course, we have the scientific committee paid attention when we define the topic of the international working group, not to reproduce the silo, but you see that somehow, if we need to work, we have to name a working group and to make it together. And of course, we have a link between the international working group and especially also a link with the others initiative. Very important, all this is our contribution somehow. So how do you expect to develop the diversity needed in the working group 1?
When I was listening to your question on the different answer, I think four points. In fact, we are back from Dakar and we organized some interaction session and panel to invite all the stakeholders to join the One Sustainable Health initiative. But we learned so much from them because in Africa and the WHO office in different countries are already organized and implementing the One Health platform on One Health at intersectoral level in more than 47 countries, especially because they consider the very increasing amount of chronic disease that are additioning or superposing to infectious disease, and they also consider the very important stakes, but also opportunity to better work and enhance and develop joint program action at intersectoral level. So we met the High Council of the One Health in Dakar, in Senegal. It's a medical doctor woman. She is directly linked to the executive secretary at the country level, the same in Uganda, and they are very proactive, and they are also, I think it was the 5 COPIL, so it's very active and very integrative integrating all the context. So we learned so much from them, but we also shared with them, because when we are in Africa, we often speak about water access, in the best case of the pathogens, but never on the chemical exposure. So they are also very interested because they consider the impact of the water pollution on the mitigation and adaptation stakes. And they also consider the water cycle is irrigating the fields like it's also irrigating all the bodies, human, animal, and ecosystem. And they also consider that the water cycle is receiving all the emission, pathogen and chemical emission, but the water cycle is also to what we are all exposed, because our bodies, human, animal, and environment, are between 70 to 80% constituted of water. So we work together. We aim to implement with them all this context in complementarity. And the water cycle by European level, but US and Southern countries, and also WHO, is under becoming a very big and nexus piece of the One Health, because we use the water cycle or the wastewater to track the COVID virus, and we can detect it 3 weeks ago, 3 weeks before outcome or occurrence of disease. But so we use the water cycle as the water cycle epidemiology or wastewater-based epidemiology, and the big amount of data that have been gathered to last year now allow all the stakeholders and the members to consider the water cycle as a very nexus piece of the One Health. So we are sharing all this experience, and I just would like to finalize or to finish with this point, Benoit. And, in fact, when we worked on environmental health, that is for me, we are all in a one environment. Of course, environmental health is crossing all the 1770s SDGs and allowed to deliver the SDGs at territory level. And of course, we are in this absolutely challenging decade of action. So when we, as explained by Marianne yesterday, I think when we make the smart and sustainable investment on all the environmental health action, we are completely aligned to Paris Agreement on climate stakes and also with the One Health stakes. So I think we are all sharing the very key and relevant experience in different areas of the world. And in fact, Africa is very active on the One Health platform.
Of course,
Thank
yes.
you so much.
Yeah. Thank you, Armel. So now we're going to listen on behalf of the International Working Group 5, Rhoda Wayanze. She is from Makerere University in Uganda. She wasn't able to be with us, but we have a short video.
Greetings to you all, ladies and gentlemen. My name is Rhoda Wayanze. I'm a professor and dean at Makerere University School of Public Health. I'm also the co-lead for the Center of Excellence for Sustainable Health, a collaboration between Karolinska Institute and Makerere University. I am excited to contribute to the One Health International Working Group 5, global levers of change to foster one sustainable health, given the synergies with the work that we are doing in the Center of Excellence for Sustainable Health. I also do appreciate the opportunity to share my perspectives on this important issue with you. The International Working Group's topic is so critical to the needs of today, given the challenges that we have just gone through with the COVID-19 pandemic. The One Health approach gained prominence following health emergencies such as the severe acute respiratory syndrome, the Ebola, as well as Zika epidemics. However, over the years, we have stagnated in terms of implementation of the One Health approach. The current pandemic that we have just gone through, as well as the emerging crisis because of climate change, as well as antimicrobial resistance and other major global challenges, wake us up to the reality that we need to accelerate this effort now more than ever. There is no doubt that we need to work together in a holistic manner across disciplines, across sectors, and we need to engage multiple actors across various levels, the public, the private, the academia, and research, among others, But how do we actually move this forward? How do we move this from aspirations to action? What is required for the implementation of the One Health approach, and what should the global levers of change be focusing on? There are some protracted challenges that we have struggled with over the years, for which the global levers of change need to provide some guidance. For example, we have struggled with the protracted issues of global governance across sectors that need to be working together. We have also struggled with funding mechanisms. The global financing mechanisms have been a challenge and sometimes come in a fragmented way that does not allow working across sectors. The public-private partnerships, how should this look like right from the global level to ensure that we are working across sectors? How do we also overcome the sectoral interests that pull us apart when we should be working together across sectors? The issues of working across discipline sectors and multiple actors require disrupting power relations so that the best ideas can come forward in terms of how we can work together, so that we can also foster equitable as well as sustainable relationships across sectors. But how can we actually make this happen? How can we minimize the power relations? How can we be able to work together in a harmonious way has become something, again, that we perhaps need to study more, something that we need to pay attention to when we are designing policies as well as guidance at the global level. What should the package look like when we talk about multiple sectors and disciplines? For example, when the One Health approach gained prominence, we defined the big three. It was human, it was animal, it was the environment. But right now we realize that we also need to bring in other sectors, for example, agriculture and many others. How far wide can we go to make this possible while we also get the synergies that are required to move these issues forward? If it's everything, then it will become intimidating and perhaps we can't move forward with it. How can we provide guidance to make this happen? What should this look like in terms of the disciplines that are most critical for us to bring together in terms of the health of the humans, the health of the animals, as well as the environment? There's also the issue of disjointed actions and progress across related sectors. When we look at even the big three, the animal lags the humans and the environment lags the other two. How can we work together across this when we have such huge differences in terms of the level of funding as well as progress across these sectors? We need to be able to provide guidance to make this work so that we can move together. And perhaps the current focus on the climate gives us an opportunity to begin to address the issues of the environment that have lagged for so long. We need to make sure that the expertise as well as the experiences of the environment teams is had and integrated in the guidance that we provide. And we need to make sure that they are represented in the International Working Group 5, as well as other critical disciplines that we need to map out. How do we navigate the disciplinary as well as sector divide? We need to generate an implementable framework on how actors at different levels, especially the global level, can get to work together. Can we learn from the local? In my experience, the lower you go, the less the divide. At the household level, at the community level, people are working together. But as you progress upwards, especially towards the global level, the divide becomes even much more prominent. And sometimes the global is disrupting the local, where we have been working together. How can we generate policies around the governance, around the financing, around the implementation frameworks that can minimize the disruption of harmony that exists at the local levels, at the community levels? We need a coordinated, multi-pronged, simultaneous, multidisciplinary, multi-sectoral, as well as multi-stakeholder actions across all levels, and especially at the global level. And this should be underpinned with policies that minimize the sectoral interests. How can we make this happen should remain on the agenda as we think through the work within the International Working Group 5. And this is perhaps an area of study in itself and should make its way in terms of how we teach and how we do our research. How can we teach people in silos? How can we do research in silos and expect different results? We need to address these issues in the working group. Thank you so much for the opportunity to share my perspectives with you, and I look forward to continuing to contribute through the global levers of change.
So, Chris, we just hear Rhoda, Dean of Makerere University, you know her, of course. And as I mentioned before, you are one of the experts really involved for years. So you have seen the evolution, and especially after with the lockdown, about taking into account this One Health, listening about members of the International Working Group. You were with us in Berlin when we had also our session. What do you think? What do you recommend? And if you have some answers to Rhoda.
All right, thanks very much, Benoit. I'm just going to try to give a little bit of an overview of what I've heard in the last 30 minutes or so. Now, I'm going to build on the presentation that was before the interview of Hans Kluge from the WHO's regional director. I came in the room and I heard him say, we need to be more agile. We need to move more. We're really slow. And this has been, every speaker has pointed out that we're so siloed. And we're going to hear this word siloed again and again and again. We need to get over it, right? We need to get over it. There's just no question that that is one of the biggest impediments to implementing, operationalizing One Health. And I'm going to sort of think what we have here with the working groups is a co-creation process. It's difficult. We need to make funding available. And more importantly, as Benoit said, everyone's a volunteer here. Everyone is already working 24/7, and we're all at the edge of what we can do. We need to make space. We need to bring in more diversity, more colleagues to help us work to drive this co-creation process forward. So I think that's sort of my enter into this theme. Now, we're very lucky. We have the OLEP, which has now come up with a definition, which is, I think, a broadly agreeable definition to everyone. I know they didn't happen in a week, and not everyone agreed immediately, but that's something we can work for. The quadripartite has a definition. Everyone agrees on it. Let's move forward with that. That gives us a really good frame to work on. There's a lot of work, as Natalia pointed out, there's a lot of work still to be done, especially in defining objectives and how to measure the metrics. This is a thing that comes up all the time. How are we actually measuring the value added of doing One Health approaches? It's intuitive to us that everyone on this panel, but when we meet donors and policymakers, they just blank out, right? You've all seen that face when you walk in and you tell them, hey, you guys need to work together. You may need to revisit your mission statement because you're actually doing exactly what your mission statement says in that little box. You're not talking to the other sectors. So the other thing we've heard all the time, and we'll keep hearing it, is for years we patted ourselves on the back. Yay, we're really good. We work with other disciplines. We're really great. Oh, we have a social scientist. You had your, sorry to say this for any social scientists here, but we used to have like our pet social scientist, and we were awful to them. We'd phone them on the last day and say, hey, by the way, we're submitting a grant. Could you just sort of join? Because we know we need you, but we don't know what you do. We got to change that. We need to work truly transdisciplinary. We need to invest in what it means to work transdisciplinary, because it's not easy. When you're sitting with people from other disciplines, it can be tedious because you're not part of their culture. You don't understand what they're talking about. So that's one thing that's come up repeatedly. We need to work transdisciplinary. But there was one little spin there. Juan, you brought up this little spin. You said, they're not all equal. Social scientist is not a social scientist. I know a veterinarian is not a veterinarian. You're not going to want to give me your cat to treat. Like, that's not going to go well. So we need to actually look with more detail. Who are the disciplines? What are their real expertise? And then when we talk about capacity building, we talked a lot about capacity building. We need to create capacity, we need to bridge capacity, and we need to have to engender a dialogue. We need to have people to talk to and colleagues to talk to. We need to have a common platform. We need, I'm going to say this a lot of things we need. But when we talk about education, we also must divert a little away from the specialization. There is a lot of benefits of having people who are specialists at being non-specialists and have a broad overview. You need to bring them in the room, and they can sort of pick out where this is going. We talk about the tensions. You know, we have the classic example of three, you know, that Venn diagram, which is completely silly: human health, animal health, and environmental health, and it sort of crosses each other. And I guess in the middle, that's where the magic happens. No one knows what happens in there. For years, I have to embarrassingly admit, I used to show this to my students and say, that's One Health, go for it. I never worried about what happens in that little weird space, but we need to. That's the point. We need to operationalize that space. We need to move from the aspirations towards action, and that is tough. We need to acknowledge it's really, really difficult. So,
time is
do I have
running out. I promise
we just have
Benoit.
2 minutes to conclude, so maybe 30 seconds. And
the last word I want to say, we have no philosophers up here. It's all about values. We need to have some training in, well, how to deal with values. In the end of the day, it's a value decision, and we need to tackle that as well. Thank you.
Thank you, Chris. I would like to thank all our speakers, Natalia, Armel, Amandine, Elev, Juan, and Chris. I think you can say thank you to all of them. And I would like also so thank you, because it's a concretely approach that we have together. And I would like also to thank the Geneva Health Forum, because since the beginning, Antoine Flao, Eric Comte, and all the teams that are involved in the process also. And to introduce you, Max Claron, because he's leading the International Working Group. He's based in London. Maybe you can stand up, Max, you know, because it's, we have also from the team, Julia, Brian, and now Savannah. It's just to mention that it's an open, as you see, an open space of discussion, you know. So come, if you have an expertise, you know, we don't care about, you know, your title. It's just commitment, committed in the working group, and to bring your energy. Maybe, Natalia, you want to end up? The last minute is for you. Can you speak closer? Yeah.
Sorry. There are many overlapping topics among the 6 groups. I heard your group, and I was thinking it's actually part of the group 6 where I belong. And something appears in my mind while I was thinking of this overlapping, that at the end we are all humans. We are all sharing. We are nature. And this is something that I'm learning with the indigenous women, that we are doing a research, interviewing women from 4 indigenous peoples. And what impressed me is that the implementation is already there in their communities. They don't need specific agreements, regulatory norms. They are behaving with respect with water, with the land, with animals, because it's in their way they relate with life.
That's right.
So what I'm feeling is that maybe we should start with that kind of re-education of ourselves, and then we can do the implementation and the aspects and the because this is something that is beyond the high level, but is more down to earth.
That's right. That's right.
So my last message is we should listen more indigenous communities. We should listen more the people who are keep land. Los guardianes, how can I say this word? The people who are protecting the stewards, exactly, because they know how to do it.
That's right.
Thank you.
Thank you, Natalia, and thank you to all of you for being with us today. You can follow on the website One Sustainable Health Forum, and also LinkedIn and all the social networks. And we also advocate for One Europe for Global Health. aside from what we are doing. Thank you to all of you. Goodbye, and we keep in touch.
Thank you.